Hi there, and welcome to the inaugural episode of Health Insurance Doesn't Have to Suck. I'm Brian Calvert, your host. For decades, I've worked in the employee benefits field in health insurance. And before that, I spent 20 years in the commercial real estate management field. And, I really got an opportunity to understand how related to benefits in health insurance. And now I run a company called Business Health Market, where we help individuals, families, and employers with their health insurance of all kinds. And these episodes here that I'm going to produce are really designed to be short and thoughtful and focused, hopefully give you a better understanding of how the health insurance works and give you some clarity. What I've discovered over the years is that what people think the reason they don't like health insurance and what the real reason they don't like health insurance or why they think it sucks is not necessarily in line. The reason people think it sucks is often because of cost, which is definitely a part of it. Don't get me wrong. But really, it's more about clarity and structure, and it's confusing. People are making financial decisions regarding their health insurance and their family without the right information and the right clarity on what it means. So it feels random. When a premium goes up, skyrockets, that feels random. When a deductible goes up, that feels random. But it's really not random. It's really the structure that's built within the health insurance that makes it confusing and where most people go off the rails. I mean, I hear it all the time. I'll have clients sitting across from me talking about how they want to provide benefits for their employees, but they really have avoided it and they haven't even talked about it. And they'll say, I just didn't do it because dealing with health insurance sucks. And they'll say it with a laugh, but underneath, I know it's how they really feel. And I do understand that feeling completely, but they'll avoid it as long as possible because of it. The terminologies are really technical sometimes. We're talking about terms like there's too many choices or they never get a clear explanation. And really, this is at the core of why I started the podcast. This podcast isn't about selling products. It's not about furthering my business. It's about understanding the system. And I really feel there's a large gap between people understanding the system and being able to make good, clear choices. And we see that every day in our business. But if you look at it, whether it's for your family or for work or from an employee plan, all the plans have the same structure, right? And health insurance works in the same way. And here's where it comes down to. Health insurance is fundamentally a risk management decision. So I'm going to say that again. Health insurance is fundamentally a risk management decision. And there's really one question you answer every time you're out there choosing a plan. How much risk are you going to keep? And how much risk are you going to transfer? And the price of that decision really is the premium. How much you pay per month, we know this, is that risk question. How much are you going to keep versus how much are you going to transfer? So, with the upcoming next episodes, I'm going to talk about things like why premiums go up, why deductibles go up. I'm going to talk about ACA subsidies, how those work and why they work, and how to get health insurance. A lot of people assume that the only way to get health insurance is to do it through your employer or to do it through the marketplace, but actually, there's other options available as well. So hopefully I can make it make sense so it's clear and not distorted. But the first order of business is making sure that we understand the language, right? So you need to understand what those terms mean: deductibles, coinsurance, max out of pocket. There was a study that was done that showed that 50% of employees, 50%, said they didn't really understand how their health insurance worked, and they didn't feel confident in making that decision when they had plans to choose from. And to further that, they also said they would rather go to a friend or a family member than to go to their HR department or a boss to ask for help in understanding those decisions. So think about that. Here's people that don't understand the system are going to go to their friends or family and ask for advice. Now, we don't know if those friends or family actually can give good advice, right? They may, but they may not. And the system's broken in that regard. So what we need to do is start at the core, which is to make sure that people understand the terms and technology and how it works so that they can make better decisions. Because otherwise, plans could feel like they're impossible to choose, or at the very least challenging, right? So in the next episode, we're going to talk about those 5 terms that people pretend to understand. We're going to make the system clear so it makes sense, hopefully. So that's all I got for you today. If you found this episode helpful, please follow it. If you have friends or family members that you think might think this is helpful as well, share it with them. I do write a companion newsletter called Clarity Notes that goes alongside this. It explains some of the things I talked about in a little more detail. So thanks for joining me for that first episode of Health Insurance Doesn't Have to Suck. I'm Brian Calvert, and we'll keep building clarity from here.